Okay. So the scenario is a 65 years old man present with progressive dysphagia. You are the surgical SHO in the clinic. Please take a focus history from this patient. Let me put the 6 minute. 6 minutes started.
Hello, my name is Ala. I'm one of the surgical doctor here. May I confirm your name and age?
Hi, doctor. I am George, 65 years old.
If you have any chance to open the camera, please open it. Continue.
Okay, nice to meet you, Mr. John. I will be your doctor for today, and I will ask you a few questions for better understanding to your condition. Is that okay with you?
That's fine, doctor. Go ahead.
Okay. How can I help you today, Mr. John?
Oh, how difficult following, doctor.
Okay, I'm really sorry to hear that, Mr. John. We're gonna work on that together to figure it out and help you. Can you tell me more about your condition?
This started 6 months ago, but I did start gradually.
Ahmed,
Okay.
can you
Ahmed, raise
please,
your voice, please.
raise your voice, please, Ahmed.
Okay.
Can you repeat?
This starts 6 months ago and start gradually.
Okay, I'm really sorry for that. Does it come and go or constant?
I cannot hear you.
Does it come or go or
Can you
constant?
I think it's constant, doctor.
Oh, it's constant. Okay. Has been gotten worse?
Yeah, it's
I see.
getting worse.
Yeah, I'm really sorry. Is it worse with you struggling more with the solid or with liquid?
Solid for doctor.
Solid? Okay, I see.
Yes.
Anything make it better?
No.
Anything make it worse?
Yes, I said to you, doctor, it's food.
Oh, okay, I see. Do you notice? Do you have any decrease in appetite?
Yes.
Yeah. There is any unintentional weight loss?
Yes.
I see. Do you feel tired through all the day, Mr. John?
Yes, I feel tired, doctor.
Okay. Do you have any? Do you have any? Do you have any pain with the swallowing?
No, no pain.
Okay, I see. There is any? Have you been unwell recently?
What?
Have you been unwell recently?
No.
I see. Do you had any fever before?
No.
Okay, I see. Do you had any trauma?
No.
I see. There is any? Do you feel there is any regurgitation while after when you're lying down? Any
No.
regurgitation for food when lying
No.
down?
No.
Okay. Do you smell any foul smelling with breathing?
No. No. No.
Okay. Do you um, do you notice or express any gargling or wet voice after swallowing?
No.
Okay, I see. Do you struggle when you swallow the solid food?
Yes. Said to you, it is so food make it worse, doctor.
Yeah, I just wanna double check. Do you express any heartburn?
Yes. Sometimes.
Okay. Yeah. Do you test any acidic test in your mouth?
No.
No. Okay. Have you been? Do you have any? Have you expressed any similar condition before?
What?
Any similar condition before?
No. No. It's the first
Okay.
time for me.
Yeah. Any other medical condition beside our condition for today?
No.
I see. Any history of surgery?
No surgery.
I see. There is any? Do you take any? Are you on your regular medication, Mr. John?
Yes, I remember I was diagnosed by GERD, and I take omeprazole 40 milligram daily.
Okay. Any reaction to any medication?
No?
I see. Now I will ask you a personal question. Is that okay with you?
Okay, go ahead.
Okay. What are you doing for living?
I'm retired primary school teacher.
Okay. Do you smoke or do you smoke?
Yes, 2 bags a day for 20 years, doctor.
Okay. Do you drink alcohol?
1 unit per week.
Okay. Who live with you, Mr. John?
My wife and youngest son.
Okay. Do you have any problem with the climbing stair?
No?
Okay. Do you feel tired through all the day?
Yes.
I see. Okay. Before we going further, Mr. John, what do you think causing this?
I think I'm afraid I am something bad, doctor.
No, it's okay. We're gonna work on that together, and we're gonna help you. What is your biggest concern?
Oh, that I will not be able to enjoy food again, doctor.
We're
Could
gonna
you
do
please
our.
present your case?
Oh, finish. Okay. I took history from Mr. John, 65, 56 years old, complaining, diagnosed with GERD and on omeprazole, 40 mg. He present he presenting complaining of difficulty swallowing associated with unintentional weight loss, fatigability, and decreased appetite. There is no history. There is no, and he heavy smoke. No, he's a smoker and drink alcohol occasionally.
Okay, from what you're
My
saying,
leading
continue, what's your leading diagnosis?
my leading diagnosis is esophageal carcinoma.
What's your other differential diagnosis, doctor?
My other achalasia, GERD, and pharyngeal pouch.
Okay, and what's your investigation?
I will do my investigation by doing a full abdominal examination and request for full blood count, urea and electrolyte, and liver function test. I will do imaging, esophageal mammography,
Real manometry, you
chest.
mean? Okay.
Yes, esophageal manometry, chest X-ray, and endoluminal ultrasound, video fluoroscopy, and
Yeah, that's enough.
barium
Can I
swallow.
ask you what is the most specific test?
It is endoscopy and biopsy.
Okay, and how to manage this patient?
Okay, I will discuss with MDD, and I will see if this patient operable for it's candidate for operation or not. If it's operable for surgery, I will do esophagostomy and radio chemotherapy. If not operable for operation, if not operable, I will do palliative esophageal stent, radiotherapy, chemotherapy, and feeding jejunostomy.
Okay, this is the last question. This station, you have 40 seconds. Okay, do you like to add anything, Ala?
Yeah, I would like to exclude any association symptom. Mr. John, do you have any headache?
No.
No headache.
Okay. Do you have any chest pain, SOB, or
No.
shortness of breath? Do you
No.
have any change in the bowel habit?
No.
Okay. Do you have any change in the urine habit?
No.
Do you have any joint pain, back pain?
Time up.
No back pain.
Okay.
Okay, thank you, Mr. John.
Ala, Ali, do you would like to start?
You start, Muhammad.
Ala, very nice presentation. Your time allowed you complete all principle of the history. Let's start from the beginning. You introduce yourself, took permission, and started by an open question. Ala, when you start to ask your patient about the difficulty of swallowing, you should ask specifically by this word. Is it start first for solid or liquid? Yeah, struggling, it's clear, but you should specify your question by which should it start first for solid or liquid. And the second point, when you ask Ahmed, did you experience any unintentional weight loss? He said yes. So the next question should be how many kilos and for how long?
Yes.
Because your station is the cancer, the malignancy. You should know.
Yes.
Is it unintentional weight loss or not? Okay. Otherwise, I have no any point regarding the discussion. You master the station of the discussion. Huge improving. I can give you 18 out of 20. Perfect. Ali, you can start.
Yes, there's a huge improvement. It's very obvious. You are not in a rush. You are asking question calmly. You finish every single station. Dysphagia is a very common station, and there's a high chance you may face it on the exam. There's still small mistakes. You're still saying there is any when you're asking. It's not there is any. It's is there any. Ala. It's not there's any. You can go to the recording later on and see. It's is there any pain, is there any this, is there any that. You said, what are you doing for living? You can ask, what do you do for living? Not what are you doing for living. What do you do for living? Or you can ask, what's your job? As simplest. But otherwise, you just need to change this if there any to there's any to if there anything when you're asking the question. But there's a huge improvement from the previous one.
Ali?
Perfect.
Ala,
Yeah.
just 1 or 2 points regarding the differential diagnosis. You exclude esophageal cancer, goiter, pharyngeal pouch, and GERD, and achalasia. Did you ask about the fever
No, I didn't.
or painful
No, I
on
didn't.
swallowing? Because
no,
one
I
of your
did not.
differential diagnosis in the discussion, you said esophagitis, so you should exclude it from the history. And regarding autoimmune, also you can ask one questions, any dry mouth or dry eyes. Regarding neurological, also there is one questions, any weakness in your limbs. Otherwise, have 90 point, perfect, Ala. Should we move to the next station?
Yes, let's move to the next. And the next we're going to be Fath Rahman. Choose one of the station for him, Muhammad.
Okay, Fath
He
Rahman,
didn't
your
practice
station
yesterday.
is headache. Okay. Let me open it from the history station. Headache.
Can Hassan be the patient for him, please?
Yeah.
Actually, I did not read it, but I will try to make it.
Of course, yeah. That's the same way. Imagine yourself in the exam. That's it.
Yeah. Fath Rahman, the scenario is a 40-year-old woman presents with sudden severe headache during basketball practice. Okay. You are a surgical SHO, and please take a focus history from this patient. Let me put a timer for 6 minutes.
Hassan.
You know the scenario, Hassan, right?
Yeah.
Yes. So
Stop.
I want you to lead to the diagnosis toward the scenario in the school to as what the word you lead it as a subarachnoid hemorrhage.
Okay.
So in the family history, you have a family history of polycystic kidney disease, and you experience severe headache that you didn't experience before, thunderclap headache, and you don't have any trauma, no meningitis, no brain tumor, nothing. Okay.
Okay.
All right, let's start.
So
And if you can open the camera, Hassan and Fath Rahman, please. Yeah. Let's start, Muhammad.
Okay, 6 minutes started.
Good evening. I'm Dr. Fath Rahman, one of the surgical doctor working here. Can I confirm your name and age, please?
I'm Mr. Yon. I'm 55 years old.
Nice to meet you, Mr. John. I want to ask you a few questions regarding your condition. Are you okay with that?
Yes, doctor, go ahead.
How I can help you today?
Yes, just I come here because of this severe headache.
Sorry to hear that. Do you want a painkiller?
No, doctor, I'm okay now.
Okay, Mr. John, can you please tell me more about this headache?
Yes, it just started about 2 days ago when I wake up in the morning with this severe headache. It's just here in my right side of my head.
Okay, Mr. John. Is this a headache all the time or come and go?
No, it's stationary. Is all the time with me.
Sorry to hear that, Mr. John. Is there anything increase this headache or decrease it?
No, doctor.
Any other associated symptom or complaint?
Such as what?
Do you throw up or vomiting?
Yes, I think I have thrown up about two times.
Is this forceful vomiting?
Yes, doctor.
Do you have any trauma to your head, Mr. John?
No, doctor.
Do you have any fever?
No, doctor.
Do you have neck stiffness?
No, doctor.
Okay. Do you have unintentional weight loss?
No, doctor.
Mr. John, I will ask you some personal question. I will start if there is anyone in the family have a similar condition.
Yeah, maybe some of my family has renal problems. I think it's polycystic kidney disease.
Thank you, Mr. John, for sharing this important note. Mr. John, do you have any chronic illness?
Yes, also, so I have diagnosed 2 years ago as polycystic kidney disease.
Okay. Do you take any medication?
Yes, they prescribed some medication for me for this disease. But I cannot remember the name of this drug.
It's okay, Mr. John. Do you have any allergy to any medication or anything?
No, doctor.
Okay, I will ask you a personal question now. What's your
Okay.
job, Mr. John?
What you said? Sorry?
What is your job, Mr. John?
Yeah, I'm working. I'm retired now. I was worked as a carpenter.
Okay. With whom you are living at home?
Yes, with my daughter and my wife.
Do you have any difficulty with the stairs?
No, doctor. I didn't think so.
Mr. John, are you smoking?
Yes, I smoke about 2 packs per day.
Okay. Do you drink alcohol?
Yes, occasionally.
How many units per week?
Maybe 2 units, not more than that.
Okay. Before going furthermore, what idea about your condition?
Well, I don't think it's serious, but this severe headache is make me where I cannot do anything in my life. So I hope to figure it out.
I hope it will not be as serious. We'll do our best to figure it out. Mr. John, what's the most concern about this symptom?
Yeah, I'm afraid this be something serious. It may be a cancer.
No worries. I hope it will not be that. Mr. John, what are you expecting us to do for you?
Yeah, I think we need to run some tests and to do some imaging to rule out or to know what my case.
Yes, we'll do our best and we'll try all the possibility to figure it out and fix it.
You have 40 seconds.
Okay. Do you have any visual disturbance?
No, doctor.
Do you have any cough?
No.
Any tummy
Yeah,
pain?
just I have some visual disturbance after develop this headache.
I see. Any tummy pain or digestive issue?
No, doctor.
Do you have any limbs weakness or numbness?
No, doctor, I didn't think so.
Thank you, Mr. John. I think I did all
Time up.
my question.
Could you please present your case?
I took a clinical history for Mr. John, who is a carpenter. His known case of polycystic kidney disease. He presents with 2 days history of severe headache that's radiating to his right side of his head, associated with projectile vomiting, no history of fever or neck stiffness, no neurological deficits. He's a heavy smoker and drink occasionally. So my leading diagnosis is subarachnoid hemorrhage.
What are your other differential diagnoses, doctor?
Also, I will consider infection like meningitis. I will consider head trauma, brain tumors, and migraine.
Okay. What are the signs of raised intracranial pressure?
Is a very short triad, which is hypertension, bradycardia, and irregular breathing.
What else?
Besides the forceful projectile vomiting.
What else?
Can I skip this question now?
Yes. What are your investigations?
After doing full clinical neurological examination, and I will do some investigation. I will start with blood, as full blood count, and liver function test, renal function test, and electrolytes. If possible, I will do CSF analysis and culture. Then I will order imaging in the form of CT without contrast.
Okay. And what's your management plan?
The most important thing to prevent more increase in intracranial pressure by elevating the bed and hyperventilation, and give mannitol to decrease edema, and give thiopentane.
Can I ask you, what is the treatment of raised intracranial pressure?
Other
Medically and
medication
non-medically. Yeah.
and medical by giving
You said
by
mannitol. Yes.
mannitol, thiopentane,
Yeah, and non-medically like?
raising the bed.
Yeah,
and
elevate head of the bed. Okay.
I believe is hyperventilation.
Hyperventilation. Good. Okay. What is the specific drug for subarachnoid hemorrhage?
Nimodipine.
Can you tell me the dose? Time
Is
up,
40,
but continue.
60 milligram 4 hours a day, every 4 hours.
Okay. And the action of this nimodine will prevent vasospasm, right?
Vasospasm, yes.
Okay. What's the surgical options?
Coiling of this aneurysm, or Berhol, or the craniotomy decompression.
Okay. Nimodipine. What is a nimodipine?
It is a calcium channel blocker, prevent cerebral vasospasm.
Okay, this is the last question. This session, very nice. Fath Rahman. Ali, you would like to start?
No, Muhammad,
Okay.
from now on, you're just going to start first
Okay.
for all the stations. Yeah.
Al-Fatih, very nice presentation. Even you didn't prepare for this session, you managed it well. You start introducing yourself and took permission. Start by an open question. And Al-Fatih, Fath Rahman, when the patient said to you, I have severe headache, yeah, you offer painkiller. Add to this professionalism. I would like to dim the light for you. Is that okay with you? Add the dim of light. And you ask just the analysis of the main complaint. You should ask the type of pain or description of the pain. Is
Sure.
it sharp? Did it move to any sides? I think you skip 2 questions from the analysis of the main complaint. You start your differential diagnosis by asking about the subarachnoid hemorrhage, forceful vomiting. Regarding the polycystic kidney disease, Fath al-Rahman, you have 2 choices. Even if you need to ask it during your differential diagnosis of subarachnoid hemorrhage, it will be fine and it's perfect. When you ask, do you vomit? Can you describe the vomiting? Were you diagnosed by polycystic kidney disease? Or you can ask it in the past medical history.
Past medical history, yes.
But take care. Time maybe not allowed you to ask it. So ask it please in the differential diagnosis. Yeah. When he said to you, I am smoking 2 packs per day, you should ask for how long?
Yes.
I am so glad that you asked about the ice. Your presentation is a very nice presentation. You mentioned all positive important things, and you jump immediately to your main differential diagnosis. The last thing I would like to add, when I asked you how to manage this patient, you should consider I will discuss this case in MDT or with the neurosurgeon. Otherwise, I have no any point. Perfect. Ali, you can start.
Okay, Fath al-Rahman, you are master in the station, bro. You are doing very good. Even though you are not prepared, you didn't prepare. Just small correction. When you say how I can help you, that's grammatically incorrect. You should say how can I?
Can I help?
Yes. So I want you to repeat it multiple times when you finish our meeting. How can I? How can I? Because you made this mistake multiple times. How I can help you today? It's all the time. Okay. Do you have any trauma? You said. It's not do you have, it's did you have any trauma to your head? Because you cannot have a trauma consequently, right? I cannot have multiple trauma all the time. So it's not do, it's did you. Did you have any trauma to your head? You know, I cannot read my handwriting. It's very bad. Yes, I've been, for Hassan, you should say I have been diagnosed with something while you're speaking to the patient. I think you said a different thing. The only meta skill you forgot about, Fath al-Rahman, you mentioned your patient name at the start, but you forgot it on the middle of the station and on the end of the station. So when you come into the family history, Mr. John, tell me, do you have any? So review the video later on, but you need to mention your patient at least 6 times during the consultation.
Sure.
Yeah, so just be careful when you are mentioning your patient name. But I have no other point. I think, Muhammad, did you ask him what is coiling is? Because that's a new question. People ask him.
I forgot to ask about it. What is the coiling, Fath al-Rahman?
I think it is the platinum wearing that inserted or put it in micro cerebral vessels to stages of the blood and forming clots to prevent more blood perfusion to that area.
I think you understand the definition. Yeah, it is endovascular treatment using platinum wears coils to induce clotting and occlude cerebral aneurysms.
Yes. Yeah. And we have a very nice picture for it on the school. So just see the picture. Endovascular coiling. It's a very important concept. Okay, cool.
I have one positive feedback to the group. Thank you, Muhammad and Ali.
Yeah.
Only just revise the normal scheme of the history and just have a quick look for differential diagnosis in this station exactly. I don't read it thoroughly, so I think we can do better if we have a time.
Yes.
Thank you very much. Thank you very much for guidance.
I just want to understand. I just want to understand. I got your point. Say it again, please, Fath al-Rahman.
I just follow your advice regarding the common question or the usual question for any history station.
Yes.
a quick look just for the differential diagnosis. So I
Perfect.
try to, yes, I follow it. I
Yes.
think we can manage it better if we have more detail about differential and investigation and discussion.
Yes.
So
Okay.
thank you on behalf of my colleagues. Thank you very much.
Welcome.
Okay,
Al-Fatih.
cool. Good. Let's move to the last station for today. Who is the patient for the last one?
Is it obstructive jaundice? يعني?
Yes, the last station is obstructive jaundice.
Yes. So
Hassan.
Rahman practice and Ala practice.
So we can give it to Hassan and start next the next session with Ahmed. Is that okay with you guys? Or
Okay, no problem.
Ahmed,
Hassan.
Ali.
Uh,
Ahmed, did you
Yes.
practice yesterday?
Yes.
Okay.
he did.
So okay. Hassan, we can start. You can start. And Ahmed will
Ahmed will be the patient.
patient for
Okay,
you.
no problem.
Yeah.
Yeah.
So
Hassan.
the scenario, Hassan. Hello.
Okay.
Yeah.
Yes.
Is a 69 years old man present with yellowish discoloration of the skin and eyes. You are the surgical SHO in the clinic. Please take a focused history from this patient. 6 minutes
Okay.
started.
Hello. Hello, I'm Dr. Hassan. I'm the treating doctor for you today. May I confirm your name and age, please?
Hello, doctor. I am Robert. I am 69 years old.
Nice to meet you, Mr. Robert. How may I help you today?
I have noticed my skin and eyes turning yellow, doctor. And my urine has become dark. It's been like just for a few weeks now.
I'm so sorry to hear that. It must be very stressful for you. Could you tell me more about it?
Yes, it is. Just my urine become dark, doctor.
Okay, I see. And how did this start? It's gradual or sudden?
To start gradually, but it's been getting worse.
Okay. And does anything making better?
No,
Does anything making worse?
no.
Okay. Could you tell me more if you notice any itching?
Yes, especially at night, doctor.
Okay. And do you have any weight loss?
Yes,
Okay. About how much kilogram you lost?
about 10 kilogram in the last month.
Okay. And what's about your appetite?
Oh, I have lost my appetite. I cannot eat everything.
Oh, I'm so sorry to hear that. I will try my best to figure it out. Okay.
Okay, doctor. Thank you.
Okay. And do you? What's about your health recently? Do you feel more tired
Yes, I feel tired.
than usual?
Yes.
Okay. And do you have any vomiting?
Vomiting?
Yeah, vomiting.
No,
Did you
doctor.
throw up? Okay. No vomiting at all, or
No.
vomiting of blood.
No.
Okay. No tummy pain.
Just a little bit.
Okay. Does the pain radiate to the right shoulder or
No.
move to the right shoulder?
No.
And is it increased with fatty meal?
No.
Okay. And do you have any fever?
No.
Do you have any history of contact with other patient has a history or has discoloration of skin or eyes?
No.
Okay. So, Mr. John, do you have any past medical history of similar condition?
No.
Okay. Do you have any past medical history of surgery?
No.
Do you have any history of hospitalization?
No, I didn't.
Okay. Mr. Peter, do you have any history of chronic illness?
Yes, I have hypertension.
Okay. And what do you take any drugs for it?
Yes, I took amlodipine, 5 milligram.
Okay. Any allergy
Allergy from what, doctor?
for drugs? For
No,
drugs
no.
or any drug?
No.
Okay. And do you have any similar condition? Do you have any family history of similar condition?
No.
Okay. And I am going to ask you some personal question, if you don't mind.
I think, doctor, my father had pancreatic cancer before.
Oh, I'm really so sorry.
Yes.
I hope he is fine now.
No,
Now
he's
I'm
dead,
going to
doctor,
ask you.
and I think that is the cause, and I will be like him.
Okay, I'm sorry for your loss. Now I am going to ask you some personal question. Is that right? Is that okay with you?
Okay.
What do you do for living?
I am a teacher, doctor.
Okay, and do you smoke?
Yes.
How many packs per day?
It was 15, but now about 10 back per day.
For how long you are a smoker?
10 years, doctor.
Okay, you. Do you drink alcohol?
Yes, about 5 units per week.
Okay, and what's your main concerns?
That's my big cancer, doctor, because my father died from cancer.
Yeah, I see. But it's too early to say that. But let us discuss this case with my consultant, and then we will figure what happened with you. And what's your main? What do you hope from us to do?
Time up. Could you please present your case?
Yes, I would like to present Mr. John, 50 or 60 years old, who has history or has family history of pancreatic cancer. He come here because of has discovery or he has joined this for 3 months ago. With weight loss, more than 10 kilo, with associated with loss of appetite and generalized tiredness. So my main diagnosis, it may be, my main diagnosis is obstructive jaundice due to maybe tumor of the head of the pancreas, and other differential diagnoses it can be esophagitis, cholestasis, and it can be hepatitis.
You said esophagitis.
Hepatitis.
Okay. And what are your investigation?
Yes, after doing full examination, abdominal examination, I will go for doing lab investigations such as CBC, LFT, RFT, and bilirubin, direct and indirect, and total bilirubin. And then I will go for urine analysis and bleeding profile, and then I will go for imaging for abdominal ultrasound and CT abdomen, ARCB if needed.
What else?
We can do MRI for staging and grading.
What else?
And
what else from the blood investigation?
Is that okay? Skip.
Okay. What is your treatment plan?
Yes, I will manage this patient after discussion with multidisciplinary team. If it is operable, I will do Hartmann procedure with palliative chemotherapy.
Your patient has CA
If
of
not
head of
operable, I will go
pancreas.
for
Please, doctor. Your patient has CA head
yes.
of pancreas. You said Hartmann procedure. What's the name of the
Yes.
procedure for this patient? CA head of the pancreas.
I cannot remember.
Okay. Time up already. Continue your management طيب.
If not operable, I will go for biliary stent and palliative chemotherapy.
Okay.
And yes, palliative chemotherapy.
Yeah. This is the last question. This session, very nice presentation, Hassan. Let us review from the beginning. You introduce yourself, took permission. You said to the patient, no tummy pain. I think Ali mentioned this point previously. You should say any tummy pain. And you are confirming to the patient, no tummy pain.
Yes, you don't.
So
yes. So when you are speaking to your patient, Hassan, instead of saying no tummy pain, that means you are confirming no tummy pain. You should ask. You should say, "Do you have any tummy pain or any tummy pain, Mr. John?" This way.
yeah.
Okay. Continue, Muhammad.
During your
Muhammad.
history, yeah, Ali. Hello.
Continue, please. Yeah, we can hear you.
Yes, during your history station, Hassan, Ahmed said to you, I am afraid that I have pancreatic cancer before eyes. And I think you didn't hear him carefully. And in this point, you didn't show any empathy. But you show it later on eyes. My advice here,
he says sorry for you. Muhammad, there's a problem with your voice, Muhammad. Fix it. There's a problem with your voice. Fix it, please.
How about now? How about now, Ali?
Yes, continue.
Yes, he said
yes,
in the
continue.
eyes. But during the history station, when Ahmed remembered that his father has pancreatic cancer during family history, he said, I am afraid that I have pancreatic cancer. He said that I am really sorry for your father, but he didn't show empathy to Ahmed. Don't worry, we will do our best to figure this out. That's the last point regarding discussion. You managed it well, Hassan, but you should mention the patient has type of obstructive joints. You said, I think you didn't mention the dark urine and pale stool. So you should mention it to determine the type of jaundice. Yeah. Otherwise, when I ask you what is the blood investigation or missed investigation in your blood, you said to me skip. While this is the most important investigation, biomarker for head of the pancreas, CA19-9. Okay.
CA1, CA19-9.
Whose iPhone is it, Fatah Rahman?
What?
iPhone. Whose iPhone?
Maybe me, Ali. Sorry for being late today.
No, that's all right. Okay,
that's
fine.
All my point. Very nice presentation, Hassan.
Okay, Hassan. Good presentation. It's not an easy station. You managed it in a good way. The small points, you change your tone multiple times, which is very nice. That's a big improvement from the last time. When he said my dad had pancreatic cancer, you said, I'm really sorry for that. Then he told you, my dad passed away. You said, sorry for your loss. So keep your tone the same. So he said, my dad has pancreatic cancer. I'm really sorry for your loss. I'm really sorry for your dad. No, doctor, he passed away. I'm sorry for your loss, Mr. John. Change your tone the next time too. So you change your tone just once. When you asked about the weight loss, you said how much kilos. When you are asking for a countable number like kilos, how many kilos? You say how many kilos, Hassan? How many kilos? Yes. Does it increase with fatty meal? You should eat. Yeah, you said for this, not for you, Hassan. This for Ahmed. You said I take amlodipine. I took amlodipine. It's not I took amlodipine. It's I take amlodipine because you're taking it every day, every morning, 5 milligram. So I take. It's not I took. During your presentation, you said, Hassan, you said he comes here with this and that. That's not wrong. That's right. But it's better to say he presented with. That's nicer when you are presenting your patient. Instead of he came with, you say he presented with this and that. Yes, but otherwise I don't have any point. Yeah. When Muhammad asked you about what the procedure, you said Hartman procedure, Hassan.
Yeah, Hartman.
Yes.
No, it's Weibull procedure.
Totally different from
Weibull, yes. Weibull procedure. I forget it.
Yeah.
Yes.
Because I didn't prepare this for station. I didn't do any preparation.
Yes, so it's a Weibull procedure. But otherwise, I think you're going to pass this station, obviously. Just focus on this small points during the presentation. All right. Okay, cool. So from tomorrow, we're going to start sessions in the knowledge. We will decide the session the day before. So today we're going to write which session we're going to practice tomorrow. And then we're going to start the session tomorrow, maybe around 2 p.m. Saudi time. Yes, Muhammad.
Yeah, I will between 10 a.m.
Muhammad, you can stop the recording now. Yes.
Okay.